Thank you for staying with Good Morning Kenya. We now talk matters health, and our conversation today is mainly on Ebola, and we're looking at the front line defense. We know that this is an outbreak that is within our region, to be specific in Uganda and the DRC Congo. Just how prepared is Kenya as a country to deal with it in case the outbreak gets to us, and how much are we ready, or what are we doing rather, to ensure that we are keeping it at bay? Those are some of the questions that will be answered right here, as I am joined by the Kenya National Public Institute Acting Director of Public Health. I'm joined by by Dr. Victoria Kanana Kimonye, who is the public health leader, and she's here to just speak on this and get to inform us, give us the proper information on matters, our preparedness when it comes to Ebola. So welcome to the program.
Thank you, Vivian.
It's a pleasure to have you here.
Thank you.
Let's talk about this. First of all, when we talk about our preparedness all together as a country when it comes to matters Ebola, just how prepared is Kenya?
Okay, I'd like to say that we think we are fairly prepared, but you can never be too prepared. We say in our setting that you're tested by the outbreak itself. Yeah, that is when we know whether the systems we've put in place are truly working. Yeah. But I can assure Kenyans that we have been working every day since the declaration of this outbreak to ensure that our preparation is as best as it can be should we get a case within the country.
Why is Kenya considered at risk?
Kenya is considered at risk because of our position regionally, especially in East Africa, and we have a very big transportation hub, both land crossings and air transport. That is the main reason we are considered at risk. Everybody in the region comes into Kenya, and we also travel within the region. So really, that's why.
So are we in a position, as it is right now, to be able to detect, any possible case of Ebola?
Yes, I would say so. And there are a number of things we've done to ensure that we can detect a case in case it comes in. One, we have done a lot of health worker training, which we are still continuing. So far, we've trained over 3,000 health workers. We are using even modern technology like Zoom to just sensitize them on the issue. So there are more than 2,700 who've been trained in that manner, and about 400 who've been trained in person. And basically it is to inform them on how to detect a case, the symptoms, and what to do should it come in. I think there's also a lot of community sensitization going on, because a case could come anywhere. It might not come to the health facility. It could be someone who's living within our estates, our villages, our homes. So we're trying to get that information out on how to recognize it. We have also are trying to make our facilities come up to standard, where these patients would be treated, ensuring that our health workers also can protect themselves when they attend to anyone who may be suspected to have Ebola. Our surveillance systems are improving day by day, and so I'm confident we can pick a case should it come in.
You've talked about our health workers, and of course they're usually at the front line in case of such emergencies just arising. So proper measures have been put in place to ensure that they are able to also protect themselves. That's what you're saying?
Yes, we've done a lot of intensive training on what is called infection prevention and control. So we've learned over time as people in this space that health workers are the ones who are most at risk when it comes to Ebola. In some of the countries where the outbreak is going on, they are the ones who are getting infected because they are interacting with the patient. So our motivation is to keep our health workers alive. Because if we do get sick, they are the ones that we are relying on. So we've done a lot of intensive training to the teams that would attend to an Ebola patient in Kenya first. Yeah, they're doing a lot of training on how to put on the PPEs and even how to put them off. Yeah, because science has told us that it is in that time of putting on a PPE and putting off a PPE that someone has the highest chance of getting the virus. Yeah, so there's a lot of intensive training going on around that.
Yeah. So who are on board on this preparedness efforts? You know, of course, the Ministry of Health is on board. You've talked about the health workers that you have been sensitizing.
Yes.
Or, you know, just who else is on board on the efforts?
Yeah, we're working with a lot of people. We cannot do this alone. So yes, the Ministry of Health and other ministries as well, what even call our One Health sectors. We have the Ministry of Agriculture and Livestock Development. We have the Ministry of Environment. We have officers from the Ministry of Defense as well who are trained with us, the Ministry of Interior. Then we have our partners, our development partners, both the technical ones and those who even assist us in other ways, and our county governments, of course. In fact, most of the training is done to county government health workers. Yeah, so Okay, yeah, so we began our training with some of the very high-risk counties, and that is Bungoma, Busia, Turkana, and we are continuing. We will be going to Mombasa, Trans Nzoia, and basically a lot of the counties along the corridor. Even as we continue with training, we will also move to other counties. We've done a lot of training in Nairobi, and participants from Kiambu County, Machakos County, Kajiado County. So we are continuing with that training, and we are sure, or we are planning, that every county will be reached as far as this training is concerned. But we focused with some of the border counties because we imagine that is where we are likely to get a case because of the interaction with Uganda at our borders.
So our border points are obviously the most at risk. So the border points, the airports, just how equipped are these stations that we've mentioned, from the airports, the border points, to ensure, how equipped are they to ensure that they have proper screenings going on, and maybe what measures are particularly practically being put in place for that? Okay,
so we have enhanced screening. If you go to JKIA today, travelers from certain countries that are a bit more at risk are getting some enhanced screening. What we're asking travelers to do is give us some of the information, and if they have symptoms, we take them aside, do an assessment, and do a testing if possible. Yeah, of course it makes that transition into the country a bit more different. You'll just spend a little time, maybe 5 minutes doing that, but it's very important for us to know who's in country so that we can give them the care they need should they develop symptoms. Yeah, so people put their details, this is where they'll be staying and all that, and we check up on them often. And if they do get sick, we attend to them and release them. But so far, let me say that we have had suspected cases, which is good because it means the people we are training are able to pick out. So that is good, but none of those suspected cases has turned positive. So as of today, we still do not have a case in Kenya. So what we are doing at the borders is enhancing that kind of screening.
So we've so far had a suspected or scares, if I may call them. We've had the scares, yes. And when this happens, where do we begin from there? So maybe there's this traveler who's just come in and they are a suspected maybe Ebola case. So what happens from there? Okay. If you could just take me through that.
Yes, sure. Yeah. So once we get that information, and we get it in many ways. Sometimes it's the traveler themselves who take themselves to a hospital and say, I have these symptoms and I have been to Congo or I've been to Uganda and I'm feeling this way. So they are attended at the facility. And what we have is that those facilities call us, and we send our rapid response teams. So we have county rapid response teams, and we have the national rapid response teams. So these teams are usually the most, I would say, sort of the experts, a little more than others. And so they will know how to attend to that patient. They go, they take a history, where the patient has been, what it is they are feeling. They take samples, and then those samples are sent to the labs that are doing the testing. We have 4 labs in Kenya now doing testing for Ebola. That is the National Public Health Laboratory. 2 laboratories, KEMRI CDC here in Nairobi, and KEMRI in Kisumu, and we have a mobile lab that is stationed in Busia. Yeah, we'll soon have another one in another border point. And so when that testing is done, and so far they have been negative, we get that report, and now we also investigate then what else made this patient sick. They get treatment for that, and then they are sent home. Yeah, of course with precaution, and told to just look for, to just make sure that they keep themselves well, and even look for more symptoms just in case. So that is how it has been working.
Okay.
Yeah.
When such emergency outbreaks come, you know, there's usually a lot of misinformation going around. So maybe just what categorically are you doing to ensure that there's proper risk communication being communicated?
Okay. Yeah, so we are putting a lot of effort to ensure that people get the right information. This being one of the ways, by coming here to tell Kenyans what Ebola is and how we are addressing it. We've sent out advisories to our counties, and we're encouraging our county governments to continue with that risk communication, even at community level. And this is something that we'll be doing every day. Ebola or no Ebola, our responsibility is to communicate to Kenyans on diseases that have outbreak potential. So really that is what we are doing.
Maybe in line with that, maybe if you could just point out some Ebola symptoms that we should all look out for.
Okay, yeah. So Ebola initially will present like many other illnesses, like malaria or even a flu. So someone is likely to feel a lot of fatigue, serious fatigue. They're very tired. They feel very tired. You're likely to get a headache, and you feel like you're just not yourself, what we call general malaise. You can get a fever, a high-grade fever. That's a fever above 38.5 degrees Celsius. You might have some abdominal pains, and with this particular strain, Bundibugyo, those are the symptoms that people are getting. Abdominal pain, some diarrhea, and vomiting. What people know is the bleeding that comes with Ebola, but that might not even happen, or it might happen much, much later. So once you have those initial symptoms, fatigue, headache, fever, abdominal pain, it is very important that someone visits a health facility, and says, this is what I'm feeling. And if they feel that they were at risk, beyond that, being at risk means they either traveled to DRC or Uganda, or have come into contact with an Ebola patient, or have handled bushmeat, like butchering and handling bushmeat, or spent time in areas where we have bats, fruit bats, then they need to give that information, because then the health worker will know how to handle them. So those are the symptoms that you initially have when you have Ebola. So you see, it's like malaria. Actually,
from the symptoms you just mentioned, it may come out as malaria, may come out as typhoid, because those are almost the same kind of symptoms that are experienced.
A flu. So we call them non-specific symptoms. And that is why it's very important to go to a health facility, or you can call 719, which is a number which we've activated in partnership with Safaricom, which I should have mentioned. We're also partnering with private companies that can help our cause, so Safaricom, and you'll get the information where to go.
So that's a toll-free line?
Yes, it is.
719.
719. And you can also get information from it by typing in star 719 hash. Yeah, star 719 hash, and you'll get information. Yeah, so that is why we are saying go to a health facility or call 719 and we can get you help. I'd also like to tell Kenyans that many counties have their hotlines as well, and you can get that information from your counties, but you'll find a way also to inform Kenyans that these are the numbers the counties have said you can call when you need assistance.
Okay. And when it comes to detection, I believe our laboratories also play a big part or a big role on this. So just how equipped are our laboratories for this, and do we only have specialized specific facilities that are able to handle this case in terms of just testing for Ebola, or most of our laboratories are equipped for that?
For this particular strain, not all. It is the 4 I mentioned, and soon to be 5. Yeah. So I think I can mention them again.
Yes, please.
The National Public Health Laboratory, KEMRI Laboratory here in Nairobi, another KEMRI Laboratory in Kisumu. We have a mobile laboratory in Busia, and we'll be deploying another mobile laboratory soon, most likely at Luahaha border point. So these are the ones that are testing for the Bundibugyo virus in Kenya today. Yeah, and as we continue to build our laboratory capacity to ensure that our dream would be that most labs can treat all sorts of diseases, and we are working towards that. But those are the 5 that can do that, and do that very well, because they are accredited. Yeah, because what we don't want is false results. Yeah, that can be very disastrous. What we have also is a very good sample referral system. Yeah, so once we pick a sample, we can have the first result in 6 hours. But we need to confirm that result. So we do 2 tests actually. So all in all, that process would take at most 12 hours. Yeah. And we are trying to shorten that time as much as possible as time goes on.
Okay, I hear you on that. So unfortunately, this is not the first time we are having this outbreak in the region. Fortunately, Kenya hasn't contacted any of this. So just, are there lessons that we've been able to draw, as a country from the previous public health emergencies that have occurred? Are there specific lessons that you can say we've drawn from that, just to inform the current preparedness? Oh
yeah, mostly because of other outbreaks. Once you hear there's an outbreak in Uganda, or the ones that were in Tanzania or Rwanda or the Congo, because they've had them a lot, we try and do some preparedness as much as possible. Yeah, and we've learned from them, because we have forums where we sit as countries within the region, and they give us their experiences, and really we rely on that quite a bit to inform the actions that we are taking. So they tell us most of the time it is the health workers who suffer the most, so we focus on training our health workers and making sure our health workers are ready to respond to a case. They tell us your labs should be up to standard. Yeah, because once you get false results, then you have the disease moving around the community and no one knows that it is Ebola. So yes, we rely on what they have gone through to inform the kind of preparedness efforts that we do.
So that is also playing a big part.
Absolutely. In fact, we have a standing meeting with Uganda every Friday. We started it last Friday, and we just via Zoom we talk. Yeah, they tell us this is what we are going through, look out for this, do this, this is how you can help us. So yes, we talk quite a bit with the other countries. And support them morally. I
like the bit of supporting them morally, because it's needed. Well, sometimes, or more often than not, we might not get everything right, right?
Yeah.
So maybe what would you say are some gaps that are yet to be filled, specifically when it comes to maintaining a high level of preparedness?
Okay. So as I mentioned earlier, a case can come anywhere, even in the community. So what we are doing it, but we have not optimized it, and we really want to optimize, is get the information down to the community so that every Kenyan is aware of Ebola. And not only Ebola, all our other outbreak diseases. Yeah, we have diseases which are common in Kenya. Yeah, there are almost 19, 20, and we keep having outbreaks around them. So would like every Kenyan to be aware and to know what to do. So we are putting a lot of effort there. The other thing is in the screening along this transport corridor. Yes, we have started, we are doing our best, but we can do better. Yeah, we feel we can do better, and we are getting a lot of support from our partners on that, all our development partners, and of course the government, yeah, which has actually committed to funding these efforts, so that anyone who's coming in through our borders, yeah, we support them as they go around, with their normal economic activities. If someone like a truck driver falls sick while they are transporting their goods, they need to find a place where they can seek healthcare immediately, and good healthcare. So those are the things we are trying to work on. They need a place where they can get information, right? So those are the things we are trying to improve. Yeah, yeah.
And speaking on that as at the same time, there have been conversations that yes, screenings are happening at our border points, yes, but mainly it's only happening to maybe the truck drivers, but there are those that are coming in on foot. They're not using the trucks or the buses, but they are coming in one way or the other. Yeah. Maybe a bicycle, a motorcycle. Would you say that that is lacking? Because there have been conversations around that, that those who are coming in maybe through bicycles or motorcycles or just on foot, then they're not getting screened, or they're not being screened. So just how true is that, and what are you doing concerning that? Okay,
so let me say at the border point, screening is happening, yeah, but I want to paint a picture of what it is like at a border point, and also understand what the disease is like. So Ebola, you will only be able to test or know someone has Ebola once they have the symptoms, not before. So you come in through the border doing your normal things. Border communities they don't know the border. You're the one who knows the border. Yeah, they're in school in Uganda, their families in Kenya. It is a wonderful community that lives there. It is Kenya that knows that has a border, and Uganda knows that has a border. I'm just giving an example, right? So they're going through their normal day-to-day lives. So they're not sick, right? They're not sick, yeah. So screening there can be difficult because we pick up people who look sick, right? So we will miss them in case they're incubating the virus. Yeah. But where will they develop the symptom? In their home, in their village. And that is why that community knowledge is very important. Yeah. So screening is going on, but we are likely to pick up a case at the border. And if someone goes to the border, it is one day they are going through, right? Yes. If they're incubating it, they will get it maybe along the journey into the country, yeah, or in their home, right? Yeah. So that is why it's important to focus a lot on the community. Yeah. But we still have to screen at the border because we can pick people who are likely to, there you will ask, where exactly were you in DRC? And if they tell you they are the epicenter of the outbreak, then you take the information so you can follow up, just in case they get sick.
So overall, practical measures are being put in place to ensure that Kenyans are secure.
As
and
much
I think
as
that
possible.
Is the question that most Kenyans have. Are we really secure? And is the government and the Ministry of Health ensuring that we are safe as a people, matters Ebola?
The resounding response to that is yes. yeah, we are safe as much as possible. And where there are gaps, that is what we are here to do, to address those gaps or challenges. And the government is doing a lot, even in providing resources to ensure that these activities we have planned to do will be done well. And I think enough resources so far, and we are quite grateful for that. Yeah.
I want to get back on, you said you are big on ensuring that you're getting the information down to the communities, because that is where it matters most, because that is where maybe you may experience someone who has a symptom, a family member, or just a neighbor who has a symptom, and you know, if they are not aware of Ebola and the symptoms around it, then it may be able to spread. So now, on getting that information down to that person, you know, in that area that may be high risk, maybe just, if you may just elaborate further on what exactly is being done. There's this which we're doing right now, which is public awareness as well, helping with public awareness. So maybe are there specific structures that have been put in place in these small communities to ensure that information is actually being passed?
So our plan is, I mentioned we began with very serious health worker training. And these health workers are also people we call the trainers of trainers. So once they get this information, they will go into their counties, their communities, and their facilities, and they interact quite a bit with our community health promoters. In Kenya, we have a big team called community health promoters, and these are the people who are talking every day with the community. So we usually train our community health promoters through their channels, and they are the ones who now pass that message onto the community. So that really is the structure that we'll be relying on and using. Initially, we have focused on the health worker side of things because we needed to make sure if a patient comes in, they'll be attended to. But now we are trying very hard to get that information down to our villages, as much as possible, and we'll use the community health promoters structure. It's a very well elaborated structure. They move around the villages and our estates, talking about all manner of diseases, and we'll just add Ebola to one of the things that they will be talking about. We also have risk communication experts who we are intending to ensure that they interact with media, radio, television, quite often to just pass that message. Of course, you know, influential people within the communities, our religious leaders, our influencers, anything that can get the message across, we are willing to do, and of course plan for and execute.
Still on the same, maybe just as a people, what practical steps can ordinary Kenyans, just we are taking responsibilities ourselves, what practical steps can we take in order to ensure that we are reducing the risk?
So being a virus, Ebola can basically, you can, you know, let me not say eliminate, but in your day-to-day work, just ensure that you keep yourself clean. Basic hand washing, or use of sanitizers, just like we did when we went through COVID. I think Kenyans understood how to keep themselves sanitized or clean as much as possible. Should you have been in contact with anyone with Ebola, or have traveled to Congo or Uganda, especially where the outbreak is to ensure that you don't spend too much time in a crowd, because you don't know who you're interacting with. If you're going for a burial, do not, touch a body, because if they did happen to pass away from Ebola, they can still transmit the virus, such like practices. And when it comes to handling meat, to avoid as much as possible handling bush meat, the butchering and, you know, touching of that meat, because you can get the virus through those kinds of practices. But to keep our general areas clean, sanitize always, wash your hands always. That is the message I would pass across, because Ebola is transmitted through our body fluids, tears, saliva, sweat, any body fluid. That is how that is how Ebola is transmitted. So also keeping our surfaces clean, and that's cleaning with alcohol or even soap and water.
Do we have Ebola vaccines, and is that a conversation that is relevant in Kenya?
Okay, yes, that's a conversation that is relevant everywhere, because if you get the vaccine, then of course we can protect ourselves. So for this particular strain, the Bundibugyo strain, we do not have a vaccine, and we do not have any medicine to address it directly. There are vaccines for other strains, but not for this one. But scientists all over the world, I think, are working towards a solution, as we speak.
Okay. All right. Another question that is relevant or has been also a question that has been asked is just how prepared are our health facilities when it comes to matters isolation? Do we have facilities that have adequate isolation and ready for such an outbreak? And also, when it comes to even protective equipment, do we have enough of that in our facilities?
So we've just concluded an assessment. We did an assessment the better part of last week and the week before that, going around the country and seeing if our facilities are up to standard in as far as being isolation facilities. And we found that some are. Others not quite, and some work needs to go into making them standard to be isolation facilities, particularly for Ebola. I know many of them had been designated as isolation facilities for things like COVID, especially during COVID. But for an Ebola isolation facility, it requires to be a certain way to reduce the risk of transmission. So that report has just been concluded, and there's a lot of work to do to make them ready. However, do we have facilities that are ready to take in a patient today? Yes, there are. The facilities are there, and the clinical teams have been trained. So what I'm saying is, if a patient, we get an Ebola patient today, there's a place they can go, they will be treated, and they will be discharged and can go home. So we do have isolation facilities that are ready to take up even up to 20 cases. So Kenyans can be rest assured.
And you know what, when we talk about this particular disease, I'm sure the county governments play a really huge role, specifically because most of them, you know, are the points of entry. You know, just maybe when we look at the county governments, what is their immediate role in this?
The county governments are the ones that are playing the major role. If you get sick in a county. It doesn't matter which county, even if it is Nairobi, and you will go into a Nairobi County facility or a Bungoma County facility. Our work is to ensure that the health workers who attend to you are trained and know what to do. So the county governments have been doing a lot of work as well by ensuring their health workers are trained. Some of them I know are planning to purchase now the PPEs. Many have made their isolation facilities available in the quarantine facilities, and their ambulance services as well. So no, they're doing quite a bit, and we do have some PPEs in country. You had asked about our personal protective equipment, and we're also planning to purchase more so that we don't have any stockouts. But as we speak, they're enough to address the first case for sure. And they'll soon be coming in more, rather.
Okay. So as we come to as we finalize on this conversation, just all together, the current Ebola risk assessment. Do we have it? Do we not?
Oh, we did a risk assessment about 6-7 weeks ago.
Okay.
Yeah. And from that risk assessment, we were rated around 66%. We looked at it and we were told these are the things you need to work on. We have been working on those things. So I'm sure it is much more now, but we have not started to do it because the recommendation is to do it after 6 weeks. So now we are due to do another one. And so maybe you can call me or one of our colleagues another time to come give an update. But I'm sure now we are much better than where we were.
How is that done?
How it is done? We work with WHO, because they have the technical expertise on this, and there are certain questions that we answer. How many people have you trained? Do you have isolation facilities? Do you have ambulance facilities? Do you have PPEs? Have you instituted a coordination structure? Those kinds of questions. Those are the ones that we answer.
So you're yet to do the next one?
The second one. We are yet to do the second one and see now where we are after addressing some of the challenges that were brought up in the first one.
Okay. All right. What would you like to just speak directly to Kenyans about on this? As we finalize.
So first, it is to assure Kenyans that the government is doing all it can to ensure that first, as much as possible, we do not get an Ebola case within the country. But in case we do, and it is possible because we are at high risk, that person will be treated well and our healthcare workers will be protected. So that it is to assure Kenyans about that. Secondly, it is to urge Kenyans to listen to trusted sources of information, and that is the Ministry of Health or the Kenya National Public Health Institute, or any of our leadership, our executive leadership, them as because once you protect yourself, then you are okay. So that is what I'd like to tell Kenyans.
All right. Thank you very much. And also just to remind our viewers the number that they can be able to maybe call or even get information on matters Ebola. If you can just repeat, the number is 719. You can be able to call it direct. It's toll free.
It's toll free.
All right. And you can also just dial *719#.
Yes.
Proper?
Yes, absolutely.
All right. *719#. In case you have you need more information on Ebola, you can be able to just dial that or call that number, and you will be able to get to understand more or get to be assisted in case there's a scare around where you are. And this is a conversation that is very important for us as a country. It is not far-fetched because our neighbors right next to us have it. So thank you so much for joining us. Thank you so much for just elaborating and giving us information on this. It was a pleasure having you.
Thank you, Vivian. And it was also a pleasure to be here and to talk to Kenyans. Thank you for the opportunity.
Absolutely. Now, my colleagues